Hello, this is Dr. David Green, CEO of the Colorado Pain Network. The topic today is 5 things to ask yourself before elective back surgery. Over 600,000 low back surgeries are performed annually in the U.S., and unfortunately half will not obtain the desired outcome. 10% will actually end up being worse than they were before the surgery was even performed. The first consideration thing to ask yourself is whether or not to seek a second opinion. A second set of eyes for your back condition may be indicated since it's a very big decision to undergo back surgery. There could be 3 recommendations. One could be that the doctor recommends the same surgery. Another one would be that recommends a different surgery or no surgery at all. If you get 10 spine surgeons in the room and show them a lot of conditions of the back, a lot of times you'll get more than 5 different answers as to how to best treat the patient. Okay? So if it's a large disc herniation, like you see here, pushing on a nerve root, it may be an easy answer, right? But for degenerative disc disease and some of these other things, it's not so clear cut. Consideration number 2, have all conservative options been tried? There's a lot of them out there. There's physical therapy, chiropractic treatment, spinal decompression therapy can help a lot of low back conditions, acupuncture, medication management, and interventional treatments, such as you see here, a radiofrequency ablation. Okay? If your condition is an elective surgery, do you really want to look back if you have a bad outcome and say, I should have tried more. I should have tried more of these conservative treatments, and I just didn't. Okay? So that's a consideration. Number 3, you really should consider the risk-benefit assessment prior to surgery. There are no risk-free spine surgeries. Adult scoliosis procedures have over a 50% complication rate, and those include minor and major things: infection, bleeding, nerve injury, anesthesia complications. Might not fuse, you might need a second surgery, there could be scar tissue that forms, any number of things that can happen. So unfortunately, studies show that half of what a doctor tells a patient is forgotten within 10 minutes after leaving the visit. So take notes and think about it really heavily. 4th consideration is a reality check on potential outcomes. Half of back surgeries, as mentioned, don't end up with the expected outcome, and 10% worse. Okay? If 50% of your pain goes away, is that going to be good enough? One example would be the FDA study on the lumbar artificial disc. You can see an artificial disc, what it looks like here. People thought that this was going to be, the holy grail for degenerative disc disease. So when they did the FDA study looking at that versus fusion back in the early 2000s, they found that it was as good as fusion, but it was not the holy grail. In fact, most of the patients at 1 year out from either surgery were still on narcotic medications. Maybe less narcotic medications than they started with, but over half were still taking narcotics. So you really need to think about that, because you have to think about, okay, if only half of my pain goes away, is that going to be good enough, or am I going to be upset about it? Maybe I shouldn't have this surgery. The 5th consideration is the timing of surgery. For elective surgeries, you can pick when you want to have it, maybe summer break or sabbatical, and a lot of that goes into how long you're able to stay out of work, if you're working. So rehab considerations, a laminectomy take about 6 to 8 weeks, to get back to work. Spinal fusion, 3 months before you can really do, especially if you're like a manual laborer and things like that. It's going to take you a while to get back and be cleared to do those things. And then adult scoliosis has a very long rehab, 6 to 9 to even upwards of 12 months. Okay? So that needs to be taken into consideration when looking at the time frame of when to undergo surgery. If you're a kid and you're undergoing surgery, you're going to bounce back very quickly. But when you get to be an adult, things take longer. The bottom line is you want to feel comfortable with your decision if it's an elective spine surgery. Okay? Because even if surgery does not produce a desired outcome, can you look at yourself in the mirror and say, that was the right decision for me, I had tried everything else, and that was my last resort. It's reasonable to work through these 5 considerations to make sure that low back surgery is the right thing for you. The top nonoperative pain management in Colorado is Colorado Pain. Multiple pain clinics accept over 50 insurances, and over 25 treatment options are provided with over 90% success rates. Pain management doctors are board certified and award winning. The number to call for treatment is 720 306 9575, and visit us on the web at coloradopainnetwork.com. I'm Dr. David Green with the network. Your pain stops here.